Have you heard about creatine and wondered if this is just for young men in gyms? Or is it something useful after 60 when real goal is not bodybuilding but staying strong, steady, and functional? Today, that is the question I want to answer. Creatine is often discussed in a young, athletic, bodybuilding sort of way. More muscles, more size, more power, bigger lifts, bigger arms, better gym results. But that is not the angle I want to take here. For many adults, the real question is not, will creatine make me look bigger? The more useful question here is, can creatine help me preserve strength, recover from training, maintain muscle function, and stay capable for longer? That is a very different conversation. And I'm in this group too. I'll be 60 soon, so I'm not talking about this as a young athlete chasing bigger gym numbers. I'm talking about it as someone thinking seriously about strength, recovery, function, and staying capable as we age. In that context, creatine becomes more interesting, not as a magic powder, not as a shortcut, not as a substitute for exercise or protein, but as a small support for the muscle system, especially when aging has started to change how quickly we recover, how easily we lose strength, and how much effort it takes to keep the body working well. Let us start with what creatine actually is. Creatine is not something strange or artificial. Our body makes creatine naturally. We also get some creatine from food, especially meat and fish. Creatine is mainly stored in the muscle, where it helps support quick energy production. The Australian Institute of Sport describes creatine monohydrate as the most common supplemental form and notes that muscle creatine and phosphocreatine can be increased through oral supplementation. That quick energy system matters when muscles have to work hard for short bursts. Getting up from a low chair, climbing upstairs, carrying your shopping bags, and pushing yourself up from the floor, doing a set of squats, walking up a hill, playing a fast point in table tennis, doing repeated short bursts of effort. These are not bodybuilding activities, they are life activities. And that is the first important point for older adults, that creatine is not just about sports performance, it may also be about functional reserve. Functional reserve means the strength and capacity we have in the bank, not just what we need on an easy day, but what we need when life asks a little more from us. When we're younger, we can often get away with a lot: poor sleep, missed meals, inconsistent exercise, not enough protein, no strength training, and the body still seems to manage. But after 50, 60, and beyond, the margin narrows. Muscle is harder to build, strength is easier to lose, and recovery is slower. A small illness, a few weeks of inactivity, or a fall can suddenly take away more function than expected. This is where the words like sarcopenia, dynapenia, or osteopenia start to matter. Sarcopenia means age-related loss of muscle mass. Dynapenia means age-related loss of muscle strength. Osteopenia means lower bone density before it reaches the level of osteoporosis. They are not exactly the same problem, but they often travel together. Less muscle, less strength, weaker bones. Becomes less confidence, more falls, more difficulty getting up, climbing stairs or carrying things, and recovering after illness. That is the triad, the three things that quietly pushes people toward frailty. And this is why I like to think of muscle as one of the quiet organs of longevity. We usually talk about the heart, the brain, the liver, the kidneys, but muscle deserves a place in this discussion too. Muscle is not just appearance, muscle helps us to move, balance, stand, lift, walk, recover from illness, manage blood glucose, maintain our independence, and reduce frailty risk. So, when we talk about creatine after 60, the real context is not vanity. The real context is health span. Health span means the part of life where we are still functioning, still moving, still participating, still independent, and still able to do the ordinary things that make life feel our own. That is senior health frame. Now, timing is one of the most common questions. Should you take creatine before exercise or after exercise? For most older adults, I won't worry about too much. Mm. For most, mm, for most older adults, I won't worry too much about before versus after. Creatine is not like caffeine. You don't take it and feel a sudden kick 30 minutes later. Creatine works more gradually. It helps build creatine availability in the muscle over time. So the main habit is consistency, not exact timing. The Australian Institute of Sport discusses loading and maintenance strategies. But for day to day use, the main principle is regular intake rather than treating it like a fast acting stimulant. If taking it after exercise with a meal helps you remember, that is fine. If taking it with breakfast is easier, that is fine too. If you exercise in the afternoon and prefer taking supplements in the morning, that is not a major problem. So for seniors, the practical question is not what exact minute should I take it? The question that matters more is, am I taking a sensible dose consistently with food while also doing the right kind of exercise? And that brings me to the exercise question. Creatine makes the most sense when the muscle is being asked to preserve and regain strength. That does not mean bodybuilding. It means resistance training that builds muscle and the bones. Resistance training can be simple. Sit to stand from a chair, squats, step downs, calf raises, wall push ups, bench push ups, resistance bands, and light dumbbells. Rows, grip work, loaded carries that you can use functionally every day to carry your grocery bags. Balance strength exercises show controlled movements that tell the body, I need this muscle. That signals matters. Creatine by itself is not the main event. The main event is using the muscle. Creatine is more like support behind the exercise, not a replacement for it. This is where many supplement conversations go wrong. People ask, does creatine build muscle? But the more precise question is, can creatine help the body respond to strength training? For older adults, that distinction is important. The supplement does not do the work for us. It may help some people train a little better, recover a little better, or maintain muscle energy a little better. But the body still needs the training signal. And if you're watching this because you're trying to stay strong after 60, 70, this is the kind of no hype health conversation I want to keep having on this channel. Not supplement worship, not supplement fear, just practical, evidence based, aware thinking that helps us make better decisions. Now, what about cardio? Cardio is excellent for health. Walking, cycling, swimming, dancing, hiking, and steady movement are all valuable. But creatine is mainly not for steady cardio supplement. It's mainly for resistance training. If your only exercise is gentle walking, creatine may still support muscle health, but you may not notice much. So creatinine becomes more relevant when cardio includes bursts, hills, stairs, intervals, fast walking surges, rowing efforts, circuit training, tennis or table tennis footwork. Anything where you ask the muscles for repeated short efforts. So the simple answer is this: cardio is fine, but creatinine pairs better with strength work and burst type activity than with slow, steady endurance exercise. Now let's talk about dose, because this is where seniors need a slightly different conversation. Most sports discussion talk about 3 to 5 grams a day, sometimes after a loading phase. Loading means taking a larger amount for several days to saturate muscle better. ASI, Australian Institute of Sport Guidance, described common loading approaches followed by maintenance dosing, and many sports studies use these kinds of protocols. That may make sense for athletes or people chasing a measurable performance effect. But for many older adults, I do not think that this has to begin here. If the aim is not bodybuilding, not rapid saturation, not sport results, but gentle support for normal dietary levels, then a lower dose can be a reasonable starting point. 1 gram a day is not a classic sports dose, but it is not silly. It is closer to a dietary top up. The body already makes creatine, and food supplies some more, especially if we eat meat or fish. So 1 gram a day can be thought of as a gentle supplementation rather than aggressive performance dosing. The trade off is that the effect may be subtle, but that's okay. At 1 gram a day, we may not feel anything dramatic. We may not see a big change in muscle size. We may not see or get the kind of result that appears in exercise studies, but that may be perfectly acceptable if the aim is conservative support. The practical senior dosing ladder might look like this: 1 gram a day with food if you're cautious, sensitive to supplements, already eating some animal protein yourself, or simply want a gentle top up. 2 grams daily if you still want a conservative dose but with a slightly better chance of a noticeable effect over time. We do not necessarily need to start with the classic sport style approach. We do not need to load. We do not need a large scoop from a pre-workout tub. We do not need a gym style blend with caffeine, stimulants, sweeteners, or marketing language. For seniors, I would start plain and simple. Creatine monohydrate, small dose with food and consistent routine. Now, what about soreness and tension? This is a useful but easily misunderstood area. Creatine is not an inflammatory tablet. It is not a muscle relaxant. It does not directly loosen tighter muscles in the way that many people might imagine. So if someone has neck, shoulder guarding from stress, poor sleep, nerve pain, inflammatory arthritis, radicular pain, or true muscle spasm, creatinine is not the central treatment. But some people feel that creatine helps their muscle recovery or training tolerance. That may be because creatine supports muscles' quick energy system. When muscles are repeatedly contracting, repairing, and adapting after training, energy handling matters. If muscle is less fatigued or recovers a little better, the person may experience less fatigue-related irritability or post-exercise heaviness. But I would frame this carefully. Creatine is not a soreness treatment either. It is a recovery support supplement that may help some people feel more resilient when they're training. Now, we need to talk about safety. Creatine has few important direct medication interactions. The main issue is kidney. Creatine or some creatine is converted into creatinine. Creatinine is then cleared by the kidneys. Creatinine is also one of the blood markers we use to estimate kidney function. So creatinine can sometimes raise serum creatinine a little, not necessarily because it is damaging the kidneys, but because more creatine turnover can produce more creatinine. That can make kidney blood tests harder to interpret. A kidney function review notes that creatine supplementation can produce a modest rise in serum creatinine without necessarily indicating true kidney injury, which is why clinical interpretation matters. This matters more in older adults because kidney reserve may already be lower, and many seniors take medications that affect kidney blood flow or hydration. The main caution areas are kidney disease, dehydration, regular non-steroidal anti-inflammatory drugs such as ibuprofen, naproxen, or diclofenac, diuretics, ACE inhibitors, diabetes with borderline kidney function, and intercurrent illness such as gastro, fever, poor fluid intake, or heat stress. The issue is usually not that creatine alone is dangerous in a healthy person. The issue is whether the kidneys are already under pressure. An older adult taking an ACE inhibitor plus a diuretic or plus non-steroidal anti-inflammatory drugs, especially during dehydration, is a very different situation from a healthy person taking 1 gram of creatine with breakfast. That is why context matters. For a low dose, such as 1 daily with normal kidney function, good hydration, and no regular kidney stressing medications, the risk is likely low. But if kidney function is reduced, medications can complicate. Creatine levels should be monitored. It is important to tell your doctor that you're taking creatine. In fact, this is a general rule, a good general rule for taking any supplements. Tell your doctor what supplements you are taking. Not because every supplement is dangerous, but because some supplements can affect blood tests, urine tests, kidney interpretation, bleeding risk, blood pressure, liver enzymes, or medication decisions. With creatine, the specific issue is creatinine. If your doctor sees a change in creatinine, they need to know whether you're taking creatine. Otherwise, the result may be interpreted without the full picture. There are also ordinary side effects. Some people notice bloating, loose stools, nausea, or a heavy feeling from water retention. These effects are far more common with higher doses or loading. At 1 gram daily, they're still possible, but less likely. That is another reason I like to take a conservative seniors approach. Start low, use food, avoid loading, avoid stimulant blends, keep the aim clear. Now, let us bring this together. So, for a senior who wants to maintain muscle and health, creatine should be presented not as a miracle supplement. It should not be sold as a youth potion. It should not be framed as a shortcut to strength. The foundation is still resistance training, enough protein, sleep, recovery time, balance work, and medical common sense. But within that foundation, creatine monohydrate may have a useful role, a useful supporting role. Not necessarily to make you bulky, not necessarily to chase athletic numbers, not necessarily to saturate muscle stores as quickly as possible, but to support the muscle system while you keep training. That is the senior health frame. The evidence is strongest when creatine is combined with resistance training. Recent reviews in older adults continue to report that creatine plus resistance training can improve strength, lean your tissue, and physical performance compared with training alone. Although results may vary by study, dose, and training program, and the group that's participating, this matters because the goal is not bigger muscles for show. The goal is enough muscle for life, enough strength to stand, climb, carry, balance, recover, and maintain independence. Enough strength to protect the bones, support the joints, reduce the slide towards sarcopenia, dynapenia, osteopenia, and frailty. Enough strength to keep doing ordinary things that quietly define independence. So the practical version is simple. Use plain creatine monohydrate. Consider 1 gram daily with food if you want a gentle dietary support. Consider 2 grams daily if you want a slightly stronger but still conservative effect. Do not worry about before or after exercise. Pair it with resistance training, not just passive hope. Do not expect for it to directly treat soreness or tension. Be careful if kidney function is reduced, if you're dehydrated, or if you use regular kidney affecting medications. And tell your doctor if you're taking creatine, especially if kidney blood tests or urine tests are being checked. That one sentence is important. Tell your doctor. Because creatine, the issue often is not dramatic side effect. The issue is interpretation. Creatine can affect creatinine, and creatinine affects how we read kidney function. Now, if you've watched this far, the main takeaway is this. Creatine after 60 is not mainly a bodybuilding question. It is a muscle health question. It is a strength question. It is a recovery question. It is a health span question. And it only makes sense when it is placed in the right order. Train the muscle, feed the muscle, rest the muscle.